In this video, we will explain you how we make custom-made insoles using a CAD/CAM process. As a first step, our trained technicians will do the clinical foot assessment and analysis. We do have a digital plantar pressure assessment system called as pressure plate, which helps us to accurately measure the static, dynamic, and postural scans of the patient. This is usually done by making the patient to stand or walk over this device to assess and record the pressure points at the plantar region of the foot. Once the assessment is done, we can email or print out a 2-page scan report and share it with your clinicians for their records. Harrismat is a manual plantar pressure scanning device which is made of multi-layer latex grids. After applying of ink, when the patient stand or walk over these grids, it imprints the pressure points on the paper inside. Using this graphical illustration, the clinician understands the pressure point and gives his opinion and treatment accordingly. The next assessment is the arch assessment, in which our technician will assess the stability of the medial arch through visual inspection and also measure the height of the medial arch using arch meter. During the gait analysis, the technician assesses the gait of the patient to make final conclusions. If need, he will record a video or take some photographs for the reference. The second step in this process is to do a foot volume scanning. Equipped with a 3D scanner with which we can directly take the foot scanning in seconds. However, we can also take the patient's foot impression from a foam box, and then the same can be scanned later in our centers and the foot volume can be digitalized. The third step in the whole process is design and fabrication. Our trained technician will carefully go through the shared details, doctor's prescription, and design the required insoles. He will incorporate the necessary correction and finalize the computer-aided design. Then, based on the customer's medical condition or sports requirements, the technician selects the required hardness of the material and also the top cover before he proceeds for the final fabrication. The final design is then milled in an advanced CAD/CAM machine and the insole gets readied for the customer.